Good morning, one and all. I am Krishna, research scholar under the guidance of Dr. Vineet KM, research supervisor and guide, PG Department of Commerce, Maharajas College, Ernakulam. Today, I am presenting a paper on an overview of health insurance policies covering COVID-19. Health insurance was introduced in India in the year 1986. Yet, health insurance has got a market penetration of 35% only. So, health insurance offers an unexpected solution for unexpected out-of-pocket medical expenses. An individual with health insurance coverage can lead a peaceful life without worrying those low probability, high consequence medical expenses. During these pandemic times, IRDA has introduced two policies for covering COVID-19 related medical expenses, namely Corona Kavach policy and Corona Rakshak policy, which offers treatment and expenses coverage to those affected with the novel coronavirus. With this pandemic making living tough, these policies offer some financial help to those affected. So, the objectives of my studies are to compare the corona-related insurance policies and to familiarize the advantages of corona health insurance policies. Research methodology. This study is based on secondary data collected from journals, papers and websites. There are two COVID-19 health insurance policies offered by the insurance service providers, namely Corona Kavach policy and Corona Rakshak policy. The peculiarities of Corona Kavach policy are it covers hospitalization expenses, home care treatment expenses, ambulance charges, cost of PPE kits, medicines, gloves, mask, doctor's fees and ICU charges. It is an indemnity type plan where the hospital bill gets reimbursed up to the sum insured limit subject to terms and conditions. And Corona Rakshak policy is a benefit-based plan where 100% of the sum insured is paid to the insured if he or she gets hospitalized as per policy terms and conditions. It offers hospitalization for a minimum of 72 hours and more as required for COVID-19 treatment in India. It also covers expenses towards PPEs, nebulizers, masks, oxygen cylinders, gloves, oximeters, etc. Ayush treatment etc. that are limited under a regular medical insurance policy. So, Corona Rakshak policy offers coverage to treatment under Ayush treatment also. So, comparison of Corona Kavach policy and Corona Rakshak policy. It can be compared on the product type, sum insured, policy period, waiting period, eligibility, hospitalization covers and add-on coverages. And the policy period and waiting period are same for both policies, and there differs in the product type, sum insured and hospitalization cover. So, Corona Kavach policy offers individual and floater policies, that is family coverage also given by Corona Kavach policy, and Corona Rakshak policy is only for individuals. And the sum insured starts in both policies from 50,000 but extend up to 5 lakh in Corona Kavach policy, but Corona Rakshak policy it is up to 2,50,000 only. The policy period and the waiting period are same for both, that is waiting period is for 15 days and policy period is 3.5 months, 6.5 months and 9.5 months. Eligibility under Corona Kavach policy, child and adult both are get covered, but under Corona Rakshak policy it is only for adult, that is from 18 to 65 years only. Hospitalization covers under Corona Kavach policy, medical expenses etc. are reimbursed, and 100% of sum insured is given to the affected if there is a presence of novel coronavirus. And under Corona Kavach policy, there is an add-on coverage like daily cash payout for each 24 hours of hospitalization for a maximum up to 15 days. Applicable for hospitalization cover only. And the service providers and the rate of premium. The rate of premium of corona policies are exclusive of GST. And for a 30-year-old individual with a 2,50,000 sum insured, the service for different service providers, the premium is different. For Max Bupa, the premium period is 523, 697 and 871. Under Future Generalia, it is 484, 610, 736, and for Bajaj Allianz, it is 726, 968 and 1210. And for Corona Rakshak policy also under Max Bupa, it is 577, 1154, 1635, and Future Generalia, it is 321, 416 and 512. So comparison comes like this. Corona Kavach policies offers both individual and family coverage, while Corona Rakshak policy covers individual only. And some insured under Corona Kavach policy starts from 50,000 and varies, it extends up to Ruba 5 lakh. And under Corona Rakshak policy, the maximum is 2,50,000 only. While both policies cover hospitalization expenses, Corona Kavach policy offers add-on coverage for 15 days also. Corona Kavach policy offers treatment cover under Ayurveda, Unani, Siddha and Homeopathic also. And Corona Kavach policy is an indemnity based plan where the hospital bill gets reimbursed, while the Corona Rakshak policy is a benefit based plan where the insurer gets the sum insured fully if he gets diagnosed with corona. So what are the suggestions are? The suggestions are to the general public. The policies covers family and individual. So need based policy can be chosen from the Corona Kavach policy and Corona Rakshak policy. And as in a general, a health insurance policy is very much essential to reduce our out-of-pocket medical expenditure. Private companies should conduct awareness programs in the public to increase the health insurance coverage and new policies related to the pandemic. Out-of-pocket medical expenditures can be managed safely with Corona health insurance policies. Insurance companies should adopt different techniques to increase its health insurance coverage during this pandemic period. And IRDA should adopt new methods for covering rural people under these policies. This study can be concluded like this. Rising healthcare costs during this pandemic period will be a burden to so many people. So paying a small health insurance premium is the simplest way to reallocate the financial losses. The newly introduced Corona health insurance policies can play a vital role in reducing the out-of-pocket medical expenditure. So avail health insurance to save you from worries of hospitalization. Thank you.